Welcome. I'm Laura Siminoff. I'm the Dean of the College of Public Health at Temple University. And I have with me here our experts from the faculty, and that's Graciela Jaschek, Sarah-Bauerle-Bass, Krys Johnson, Heather Murphy. And today we're going to be discussing several issues, including vaccines, when we can or when we should open back up, and what will need to happen in order to stay open. So I'm going to start with Krys. A lot of people are talking about figuring out who has or has not had COVID-19. So if you had COVID-19, does that mean you can go about your daily life as usual? No more social distancing, go to a restaurant, go to the beach? What would that mean?
So just because you've had COVID-19 doesn't mean that you can just kind of go about as normal. You should still be wearing your masks and be social distancing because, particularly important, we've found out that people can become reinfected with COVID-19, and we don't know how quickly that can happen. So you need to still be behaving like you could become infected with COVID-19, not only to protect yourself, but also to protect everyone around you.
Okay. So Heather, following up on that, we're hearing that this antibody test are potentially the silver bullet to dealing with this pandemic. Is it true? And if not, why not? And maybe talk a little bit about what is the antibody test.
Yeah, that's a good question, Laura. So I would say antibody tests are going to be one tool in the toolbox moving forward, not like our silver bullet.
Mm-hmm.
And kind of building off of what Krys said, like an antibody test actually tells you if you had the virus. So if you were exposed before, and that's helpful if we know that you can't become reinfected, but we're not sure about that. It's obvious that some people can become reinfected, and therefore the antibody test might not be as useful as we thought. Because if we thought you could only be infected once, well, then that would be maybe a more useful tool. Or if a reinfection is definitely milder than the first infection, but I think we're not there yet. What it might do is help identify populations that could return to work, like healthcare workers earlier, because maybe their risks are going to be less, but we're still not sure about that. The other really important thing about antibody tests is that they don't replace active testing. So they can't tell us if someone currently has the virus. And we need to know, we need to be able to identify those people, particularly if we kind of open up and we go back to basic epidemiology where we trace people's contacts. And so we find out that someone's sick with the virus, and then we look back and see who they've been in contact with and then quarantine and track those people. And that's really what we need to be doing. And so the antibody tests don't meet that need. And just one last thing about the antibody test is that right now there's 14 on the market in the US, and according to some recent research, they're performing poorly, and only 3 out of 14 seem to be performing the way they're supposed to. And when they talk about performance, they mean they have a really high false positivity rate. So it means like they're telling people that they've had the virus when really, in fact, they have not.
Right. So that sounds like we're back to everybody's hope, which is the vaccine. So Graciela, can you first just walk people through how do vaccines work?
Okay, that's true. We are hoping that the vaccines that we develop are going to work. Vaccines work by stimulating our immune system to produce antibodies, and these antibodies will fight against a specific disease. Usually, when you get vaccinated, we develop immunity against the disease. And that means that if you are exposed to that disease again, then you are going to easily fight it off. But how do you stimulate the immune system to fight against the disease and not make people sick? So some examples of vaccines that stimulate the immune system without making you too sick are those that include a weakened or dead virus, or a piece of the virus code, or a piece of virus RNA. But in addition, you need to figure out if one dose is enough to stimulate the immune system. And you also need to make sure that the vaccine works for different groups of people, such as children, the elderly, healthcare providers who are in constant contact with the sick people, and people with underlying conditions.
Okay, so here's the question. When might this vaccine be ready? I know I just read in the paper recently that there's a group in Oxford in England who have said that they're going full bore on testing and So what are we looking at realistically?
So realistically, based on the knowledge and experience of scientists, they say that it will take at least 12 to 18 months, even if the vaccine is fast-tracked. The vaccine process takes a significant period of time because there are several steps that must be taken. First, you have to develop the vaccine in animal models. Then you have to test it among humans in 3 phases. So one is to determine the safety and the ability of the vaccine to generate an immune response. The second phase is to determine the right dosage. And the third step is to determine if it is effective in large populations. So vaccine candidates may fail at any of these steps. So because we have a candidate doesn't mean it's going to work. Currently, there are about 70 vaccine candidates across the world, and 4 are entering, including the Oxford one, 4 are entering the first phase of clinical trials. So the last step in the US is for the vaccine to be approved by the Food and Drug Administration for use. And it's only after FDA approval that production can be ramped up for mass production. And that mass production is usually costly, and it's a long process that may take months. Yeah.
So that leaves us with looking at this pandemic extending much longer than I think anyone would hope that it would last. So I think that leads us to thinking about kind of the information overload that, you know, anything that comes out of a lab, a university, suddenly gets lifted up into a major news story. And so there's sort of a new word about the news, which has been called infodemic. So Sarah, can you talk about that and describe what's really going on when we get a news feed, look at the newspaper, look at our television, and we hear all this stuff?
Sure. So the infodemic is kind of a word that's been created to describe all this kind of random and a lot of incorrect information that's out there. The World Health Organization defined this and talked about it as something that we're combating as much as the pandemic, and they define it as an overabundance of information that makes it hard for people to find trustworthy sources of information and reliable guidance. So, you know, for example, this March, there was a post that was going around on social media that was attributed to Stanford University, that if you could hold your breath without coughing for more than 10 seconds, then you couldn't possibly have COVID-19. More recently, there's been a lot of chatter about 5G mobile networks, that's how COVID-19 is spreading, and not through, you know, person-to-person contact. You know, I think unfortunately, a lot of this information is very political and posted on purpose. Some of it's to sow doubt about everything from testing to prevention to the origins of the disease. Some of it is just all good information, but there's just so much of it because there's so many outlets for that information. And so this is being done by media, but then also by, you know, foreign governments and political organizations, and, you know, even white supremacists are getting in the game by kind of taking advantage of all these stay-at-home orders. So I think, you know, for consumers, you know, what do? I think we've talked previously in these videos a little bit about being very careful about what we read and, you know, checking out sources to ensure that they're accurate. I think the most important thing is just not to share or retweet or email anything that you really haven't verified is true, because that's how these things kind of blow up in our social media.
Okay. So it sounds like in the meantime, we don't have a vaccine. We don't have very good treatment. We are all practicing, at least most of us, social distancing, working from home, educating our children at home. But there's a lot of talk around opening up or gradually opening up. Georgia is certainly moving forward with this, but I know that there's some guidelines that really were established by the CDC. And so what about opening up. Krys, talk about a little bit about what are the metrics, what are the indicators that would tell you that we are ready to start loosening up what we're doing and gradually being able to congregate, go to work, go to a restaurant. What does that look like? What tells us that we can do that?
So what we want to see is a consistent, so a 14-day decline in the number of cases and a 14-day decline in the number of hospitalizations as well. But to that point, we should also be considering that we should be expanding testing quite a lot at that point. So it shouldn't be that we see a decrease in cases because we've decreased testing. We should be increasing testing and still seeing that decrease in the total number of cases as well as hospitalizations. Something else that we might not consider is that we also need to make sure we have double the amount of necessary PPE at the time before we even start reopening, just because whenever we start relaxing social distancing orders, we are definitely going to see an uptick in cases, and we want to make sure that our healthcare workers are going to be prepared for that.
So, I mean, we all live here in Pennsylvania, in the city of Philadelphia. I don't see as much news about Pennsylvania or Philadelphia as I do about New York or some other places. So where do you think we are in this state, in the city?
So in the state, I think that we are on the plateau of the flattening the curve. The governor recently released some guidelines having us in red, green, and yellow, or red, yellow, and green phases.
Right.
So obviously right now we're in the red phase, and red means that there's widespread community spread of COVID-19 in most of the state. But he released this metric saying that whenever there are 50 cases per 100,000 for that 14-day period, it's a 14-day average, then areas can begin to reopen. And so theoretically, counties that are not like Philadelphia, are not as population dense, don't have as much kind of movement between them, could start to open. But one thing that's been consistent across the governor's messaging and the Secretary of Health's messaging is that Philadelphia will likely be one of the very last places to be able to reopen. And whenever we get to that yellow stage, we can go back to red. So like I said, we anticipate an uptick whenever we start relaxing social distancing measures. When we see that, we could go back to red. And it's important to consider that even in the yellow phase, you would still only be able to have 25 people together. So at that point, classes, weddings, and reunions still would not be possible.
Okay. So Heather, Krys talked about testing, that we really have to have much more testing. So what do we need in terms of testing? A lot of times we hear the president say, we have done more tests than any other country in the world. On the other hand, we have a pretty big population. So talk to us about that.
Yeah, we need to talk about, when we talk about testing, not the number of tests we've done, more the number per capita that we've done. And so if we compare us to the rest of the world right now, we're testing at around 44 people per 100,000 per day. And we need to be at 150 tests per day. So kind of 3 times the amount of testing. We're testing about 150,000 people across the country daily. And what we should be doing is around 500,000 to 700,000 tests daily minimum. That's at a very minimum based on some research out of Harvard and some other institutes. And the reason behind that is we have a really high test positivity rate, meaning of all the people we test, 20% of them have COVID-19. In order to be really able to open up and do what other countries have done, we need that rate of positivity to be like, ideally like 2% or under 8% is what some of these other countries are at, like Germany, Australia, New Zealand, Canada, South Korea. And so the idea of having fewer positive cases means we're casting a wider net, because right now we're just testing people with kind of more severe symptoms. So if we were to kind of look at, assuming that the 30,000 people that are getting diagnosed with COVID-19 every day, assume that they're only serious cases, and all of the cases in the US say 20% of them are serious, it means that there's actually probably 150,000 cases a day in the United States, as opposed to that 30,000 that we're picking up with the testing. So that just means we really need to ramp up our testing in order to start detecting those people and stop the transmission.
Wow. So I think that leads us to the final thing we're going to discuss, which is that, you know, obviously this is going to go on for a very long time. And I think people are feeling very fatigued, and it's only been, depending on where you live, 2 months, 1 month, 6 weeks. So Sarah, talk about that fatigue and talk about how, first of all, parents can deal with their children and their families in terms of that fatigue, and just generally in how we all can deal with it.
I mean, oh my goodness, it's tough to be a parent in the best of times, I think, but it's certainly even more challenging when, you know, you're trying to be everything to your child, a teacher, an entertainer, a disciplinarian, and, you know, just a parent kind of on a daily basis. And for many people, they're also working at home too. So they're trying to juggle this, you know, work and parenting and teaching and all of those things. So, you know, I think the best thing that parents can do is try to acknowledge that both they and their children are stressed out by all of this, they are fatigued, and to really just cut themselves some slack. There are a few things that I think parents can do to help both themselves and their children. So things like, you know, just really trying to be a role model, because children react to and kind of follow reactions of their parents. Trying to be aware of how they talk about the pandemic. So the way they talk about it can either increase or decrease fear around what's happening in the world. To really explain what social distancing is, especially now that it's been 6 weeks or so. Kids are really, you know, pent up in the house. They want to be out, they want to be doing things, and it's hard. And so trying as much as you can to explain that to them. Showing them and yourself how to deep breathe, and you know, trying to address some of those feelings of anxiety. Trying to focus on the positive as much as you can, that, you know, you're all together and this is an opportunity to do some things together. And as we've talked about in the last few weeks, just trying to establish and maintain that daily routine, both for yourself and your children as much as you can. And then the last thing I think is just to offer lots of love and affection, both for them and for yourself, and to realize that, you know, this is something that none of us really know how to deal with on a day-to-day basis, and we're doing the best that we can.
Well, that's a really good series of advice that you just gave, and I think something that I could, even though I don't have children in the house anymore, could definitely use. So I think that's it for today. To hear last week's panel, view the other videos and links to reliable information, please visit cph.temple.edu/coronavirus. Thanks.